Okay, so let's dive right into what is truly one of the most perplexing and disturbing medical stories of our time.
Imagine you need a new liver. For most of us, anywhere in the world, that means years on a waiting list, a really stressful, uncertain time just hoping for a second chance. But what if I told you one country claims to offer a shocking alternative?
And just look at this. This chart really drives the point home. In the US, you're looking at over 2 years for a liver, more than 3 for a kidney. But in China, that wait time just plummets to a few weeks. It's so fast, it's created this whole phenomenon called transplant tourism.
Yeah, it's as easy as buying a port kidney. That's a quote from a patient's family member, and it really captures that on-demand feeling of the whole system. But it also raises a really chilling question, right? When we're talking about human organs, how is that kind of efficiency even possible?
Okay, before we go any deeper, there's a key medical idea we absolutely have to understand. It's called brain death. This is the only state, the only one, where vital organs like a beating heart or a liver can be legally and ethically taken for a transplant. Keep that in mind because it is right at the heart of this entire story.
So, to really get a grip on this system, we need to put a human face on it. And that story starts with a woman named Li Ping. Her family's tragedy, uncovered by her own son, is what really pulled back the curtain on a deeply disturbing reality.
So check out this timeline. It's shockingly fast and just bizarre. The ICU director basically tells the family Li Ping isn't going to make it and pressures them to donate. And then, just a few hours later, her organs are taken out. But not in some sterile, high-tech operating room. No, in the back of a van that was disguised as an ambulance.
But here's where it gets even crazier. When her son, Shi Shanglin, starts digging around, he finds out the whole donation was a complete sham. The forms were incomplete, and there was absolutely no official record of his mom's donation anywhere in the national system. It's like, from an official standpoint, it never even happened.
So this wasn't just some sloppy paperwork. The source we're looking at argues this was straight-up murder. Remember what we said about brain death? For a liver to be usable, it has to come from a body with a beating heart. This strongly implies that Li Ping was not brain dead. She was likely still alive when they started taking her organs, which makes this intentional homicide.
And it turns out, the case of Li Ping wasn't just a one-off tragedy. The investigation started to uncover that this was part of a much bigger, coordinated, for-profit network operating right inside the medical system.
So here's how the scheme was apparently set up. An ICU director, like the one in this case, would pinpoint a patient. Then an outside surgeon would come in to do the harvest. And the final step? They would essentially launder the illegally sourced organ by plugging fake data into the official national registry, which is called COTRARS. So a system that was built for transparency was twisted into a tool for a cover-up.
And this wasn't just a one-time thing. The investigation that Li Ping's son kicked off, it ended up uncovering at least 10 other similar cases, all from that same hospital. This showed a clear pattern of abuse, turning dying patients into a source of profit.
Okay, so cases like Li Ping's, they hint at a much larger problem. But when we zoom out and look at the national statistics, well, that problem becomes a massive, completely unexplained paradox.
So to really get this puzzle, you first have to understand the supply side. In China, there's a deeply ingrained cultural tradition of keeping the body whole after death. And because of that, the country has had one of the lowest voluntary organ donation rates in the entire world. We're talking just 0.6 donors per million people back in the early 2010s.
Okay, so tiny donor pool, right? But now, let's flip to the other side of the equation. Despite that tiny number of donors, independent researchers estimate that China is performing somewhere between 60,000 and 100,000 transplants every single year. You can see right away the numbers just don't add up.
And look, even if we totally ignore that independent research and just stick to China's own official, much more conservative numbers, there's still this huge, glaring gap. In 2019, they reported almost 20,000 transplants, but only about 5,800 voluntary donors. It just doesn't compute.
And that brings us right to the absolute core of this whole mystery. The numbers don't match. So, where in the world are all these organs coming from?
For a long time, the official story was that the organs came from executed prisoners. But, as we're about to see, the evidence tells a very, very different story.
Yeah, so here's the big problem with that executed prisoner story. If you look at this timeline, executions have actually been going down since 2007. Then, in 2015, China officially banned using prisoner organs, but the transplant numbers, they didn't drop. They stayed high. The truth is, the number of executed prisoners was never really enough to explain all the transplants, and now that source is supposed to be gone completely. The math just does not work.
The source makes a really powerful point here. Think about it. To be able to schedule a heart transplant 2 weeks in advance, which one Israeli doctor found out his patient had done, you can't rely on random accidents or scheduled executions. The only way that works is if you have a living, breathing organ bank, a huge pool of pre-screened people ready to be, well, harvested. You just can't schedule a car crash.
And this suggests something truly terrifying, the creation of a whole new category of human being. A Canadian doctor described it with this chilling phrase: people who are alive but have been made into dead people. They're not being treated as patients to save, but as a collection of spare parts to be used.
When you look at the sheer scale of this, the efficiency, the sophistication, it just doesn't feel like scattered criminal gangs. The source material points to something much bigger, something far more organized, with potential state-level involvement.
And the evidence for this comes from a few different places. First, researchers found that some of the official data in the organ registry looks like it was mathematically faked. Then you have the deep involvement of military hospitals. You've got these special health projects for top leaders that talk about organ regeneration. And perhaps most damning, you have public statements from former officials directly linking the state security system to the organ supply chain.
And this quote from a Chinese magazine seems to seal the deal. It says that 98% of organ sources are controlled by systems outside the Ministry of Health. And what are those other systems? They're identified as the country's military and judicial branches.
And all of this leaves us with a final, deeply unsettling question. When a country's medical system can provide a vital organ with the speed and efficiency of ordering something online, you have to ask yourself, what profound ethical lines have been crossed, and who or what is being treated as the product?